Thank you to the organizing committee for the opportunity to speak with you today. On behalf of my supervisors and colleagues, I'm honored to present our pilot project investigating the feasibility of an automated bladder diary. My name is Jonathan O'Brien. I'm the Urology Registrar at Peter MacCallum Cancer Centre in Melbourne, Victoria. We have one affiliation to disclose, and that is that Kasim Health provided the IU flow device for the study. The study is entirely self-funded with no further conflicting interests to discuss. Paper bladder diaries have been the gold standard for the past 50 years for diagnosing and investigating lower urinary tract symptoms due to the fact that they are low cost and adaptable. However, adherence can be difficult to achieve due to requirements for handling urine, manual transcription of sheets, which can lead to issues with accuracy and compliance. With the increasing traction of smartphone technology in Australia and over 21.5 million users, we asked, can portable technology be used to improve the bladder diary? And can we go from a system that you see on the right to one that looks? Our pilot study compared a traditional paper bladder diary with the integrated IU Flow platform. This is a smartphone bladder diary application integrated with a reusable toilet-based measuring device. The questions we wanted to ask were, can a digital system improve patient compliance, data accuracy, and overall satisfaction? The IU Flow is a compact device that fits over the toilet bowl and is calibrated with a dedicated app prior to voids. This generates a time-stamped record of the frequency and void volumes and avoids the needs for transcription and handling of urine. Post-void parameters such as urgency and leakage are prompted from the user after the void, and manual inputs of fluid intakes are required. Our study had a broad inclusion criteria of healthy volunteers over 18 years old who are fluent in English and owned a smartphone. The initial survey was conducted on perceptions of bladder diary platforms to investigate pre-existing bias. Volunteers were then given a brief online tutorial on using the IU Flow app and device. They were then instructed to complete a 24-hour bladder diary, and a post-diary survey was conducted to assess their experience. Participants were then asked to complete a 24-hour paper-based diary and complete a final survey to compare their experiences. Objective data was collected on missed data entry points and time to complete the diary. Subjective data was collected on device preference, difficulty of diary use, and sleep disturbance. 13 healthy volunteers were recruited to the study, 4 females and 9 males, with an age range of 22 to 59 years old and a mean age of 35. The automated bladder diary took almost 50% less time to complete, and participants experienced an easier return to sleep. There were significantly fewer missed events for oral fluid intake and voiding with the automated diary, and initial surveys demonstrated that there was equivocal preference for voiding diaries. However, post-study surveys detected a significant preference for using the automated diary. Ease of use, lack of urine handling, and easier return to sleep were cited as highlights of the digital platform. Some of the limitations of this study are that it is a small sample size with healthy participants. There were fewer females to males, and only a single digital platform was investigated. Only a 24-hour comparison for each diary was used, and this is shorter than the recommended 72-hour duration that is used for diagnostic purposes for traditional voiding diaries. Our study shows that digital bladder diaries result in fewer missed events and take a shorter time to complete when compared to traditional paper-based diaries. An opportunity exists for digital bladder diaries to improve the quality of data and enhance patient experience. However, these devices are less versatile and certainly more costly than traditional platforms, and raise issues around privacy and data sharing with clinicians that still need to be addressed. In recent months, a wireless Bluetooth device has been launched that also records flow rate data in the home. With COVID-19 limiting face-to-face consultations, it may make a compelling argument for the safety and convenience of bladder diaries to be done digitally from the home. As the technological landscape continues to evolve, a more extensive investigation is underway to further investigate whether smartphones and home flow meters can offer a viable alternative to the time-tested urine jugs and papers and pencils. Thank you for your time.